share your screen. Clinical Teaching Plan HPV Vaccine Education by tgraham. Needs Assessment HPV Vaccine. Approximately 80 million Americans are affected with a type of HPV. Each year, 14 million Americans will be infected with HPV, including teens. HPV will cause 33,700 cases of cancer in both men and women. The needs assessment gaps in knowledge. The office staff is not educated on HPV or the HPV vaccine. The office staff does not educate parents and patients of age-appropriate individuals on HPV vaccine. The description of my learners, medical assistants at primary care clinic. There are two females, both speaking English. One is of the Caucasian and one is of Indian descent. Their ages are 27 and 33 years of age. There's no cultural considerations noted. And between them, there's 1 to 10 years of experience with a high school diploma and some college. Goals and objectives. The medical assistant at St. Camilla's Family Practice will be able to identify 90% of male and female patients that will benefit from the HPV vaccine, will have an increased understanding about the HPV vaccine, and be able to provide education to parents and patients by the end of this training. 1, by the end of the training, the medical assistant will be able to list 6 safety and effectiveness facts that pertain to the HPV vaccine during post-quiz training. By the end of the training, the medical assistant will be able to state the degree of effectiveness of the vaccine and 3 types of cancer caused by the HPV virus during post-training quiz. By the end of the training, the medical assistant will be able to identify the age group appropriate for the HPV vaccine during the post-training quiz. Teaching method used is role play. Role play allows the staff to apply content while allocating resources in the role of decision maker to discuss with and educate patients and parents about HPV and the HPV vaccine. Information will be provided to the staff through the use of PowerPoint presentation and written handout to provide specific, detailed information regarding HPV, the HPV vaccine, and the target population. Following the review of the handout and the PowerPoint presentation, a multiple choice and fill-in-the-blank quiz will be administered to staff to test retention of knowledge. While using the information provided during the education session, medical assistants will work through 4 to 5 scenarios. They'll be practicing discussion of HPV and HPV vaccine with the patients and parents. The medical assistants will alternate these roles, each acting as either the patient or the parent or the medical assistant. Following each scenario, debriefing sessions will be used to discuss areas for improvement, allowing the medical assistants to ask any questions and provide time for discussion. The review of literature. The motivation of student radiographers and learning situations based on role play simulation, a multi-centric approach involving trainers and students. It was a case study. The level of evidence was 4. 3 role play scenarios were performed in 2 institutions to determine the effectiveness of this type of learning with motivational dynamics. The conclusion was role play sessions were effective in developing high motivational dynamics for students. A randomized control study for role play in a faculty development program was a randomized control study. The level of evidence was 2. And from 2009 to 2010, researchers used a randomly assigned 49 physicians from Uppsala University Hospital in 2 types of faculty development courses, a standard course with role play or an alternative course with no role play. play. Conclusion, self-assessment ratings were significantly greater among faculty who attended a standard course with a role play compared to those in the alternative course with no role play. This study supports the idea that role play is a useful instructional method. Improving evidence-based practice in postgraduate nursing programs, and this was a systematic review. The level of evidence was 1. A systematic search was used to identify eligible randomized controlled trials and quasi-experimental studies conducted between 1979 and June 9th of 2017. The following databases were used: the ERIC, the PsycInfo, Medline, CINAHL, and Cochrane database of systematic reviews. The conclusion was evidence supported that the role play demonstrates improvement in evidence-based practice skills and research knowledge translation. Teaching joint attention and peer-to-peer communication using the cool versus not cool procedure in a large group setting. This was a randomized control trial. Level of evidence was 2. There were 16 children independently diagnosed with autism spectrum disorder, and they were randomly assigned to 2 groups. One which received the intervention first, and the second group was a wait list group that received the intervention at a later time. This study aimed to identify the effectiveness of the cool versus not cool procedure in the social behavior, which includes modeling appropriate, which is cool, and inappropriate, not cool behavior. Provide the learner with opportunities to role play the cool or appropriate social behavior and providing corrective feedback and positive reinforcement. The conclusion was results from the study showed that the cool versus not cool procedure, which includes role-playing appropriate behaviors, was successful in the majority of the participants who acquired both joint attention and the peer-to-peer communication skills. The synopsis of the literature review. The reviewed articles demonstrate that role-playing is successful in improving peer-to-peer communication skills. Role-playing is an effective instrumental method. Role-play improves evidence-based practice skills and research knowledge translation. Also, there was differences in the study. There were 2 level of evidence 2s, 1 level of evidence 4, and 1 level of evidence 1. One was a case study. We had 1 systematic review and 2 randomized controlled trials. My population of study was, the first study was student radiographers, the second study was physicians, and the third study post-grad nursing students, and the fourth study were children. The 4 articles assessed role play and the increase in learning and retention. Rationale for selecting role play. Role play allows the learner to participate in real-life situations in the form of scenarios where the learner can participate how to deal with a particular situation without fear of making mistakes. The role play uses a combination of communication, problem solving, and self-awareness. These skills are used to enhance the retention knowledge of the learner. The learning theory integration was Albert Bandur's social learning theory. Bandur's social learning theory is based on the concept of reciprocal determinism and the social influences that affect learning. Knowledge is acquired through observation and modeling others. The teaching method selected, role play, relates to this learning theory because it focuses on how individuals learn from one another, along with the concepts such as observational learning, imitation, and modeling. The appropriateness for my audience. Role play transforms information into experience. It allows the participant to switch roles so they can experience the opposite side of the role. The target audience are high school graduates with some college. The teaching concept with the objective 1. By the end of the training, the medical assistant will be able to list 6 safety and effectiveness facts that pertain to the HPV vaccine during the post-training quiz. The content, HPV vaccine safety and effectiveness will be discussed, as well as benefits of the vaccine. The methods of instruction, information will be presented via PowerPoint and printed handout. The information will be discussed prior to the role play. Roles will be discussed and reviewed as a group. The time allotted, 15 minutes for the presentation, 30 minutes for role play and debriefing, 15 minutes for group questions and answer sessions. The resources used were the CDC 2019 and role-playing exercise of 2018. Objective 2, by the end of the training, the medical assistant will be able to state 3 types of cancer caused by HPV viruses during post-training quiz. The content will be 6 types of cancer will be discussed: back of throat, cervical, anal, vaginal, vulvar, and penile. Method of instruction: information will be presented via PowerPoint and printed handout. The information will be discussed prior to the role play. Roles will be discussed and reviewed as a group. The time allotted is 15 minutes for the presentation, 30 minutes for role play and debriefing, 15 minutes for group questions and answer sessions, and resources, again, CDC 2019 role playing exercises 2018. Objective 3, by the end of the training, the medical assistant will be able to identify the age group appropriate for the HPV vaccine during post-training quiz. The content, discussion about age for first vaccinations for boys and girls 11 to 12 years old, second dose 6 to 12 months after the first dose, and vaccine recommendations for women through age 26 and males 21. Method of instruction: information will be presented via PowerPoint and printed handout. The information will be discussed prior to the role play. Roles will be discussed and reviewed as a group. The time allotted is the 15 minutes for presentation, 30 minutes for role play and debriefing, 15 minutes for group questions and answer sessions. And again, the resources are CDC 2019 and role play exercises 2018. The evaluation for the learner. Learners will demonstrate their knowledge during the role play exercises and discussion during debriefing. The medical assistants will also be given a post-test to evaluate their retention of knowledge. Examples of the post-test knowledge evaluation: they will list 6 safety and effective facts that relate to HPV vaccine, state the degree of effectiveness of the HPV vaccine, and list 3 types of cancer caused by HPV. The evaluation sample form for the instructor and the presentation. It will go through 1 through 4, with 1 being strongly agree, 2 slightly agree, 3 slightly agree or disagree, and 4 strongly disagree, and allowing for additional comments at the bottom. These are my additional resources and references.